Dear Professor Tot, thank you for having time for us for a short interview on the symposium you chaired together with Anna Cepino this morning in the opening long course on breast pathology. For me it was a very exciting combination of news and presentations that have relevance to research as well as clinical practice, and combining new fields that are emerging in pathology. And it showed the pathology perhaps is defining a new role or finding more precisely its role. There was a slide, the pathologist, the man in the middle of predictive as well as post-therapy evaluation. So what's your impression on that?
My impression is that we had a very successful session with speakers from abroad, I mean from Australia, from US, and also European speakers. You are right, it was all about finding the place of pathology in this diagnostic and prognostic process in an era when we have molecular medicine, genetics is evaluating all the time, and we have new therapy modalities. At the same time, surgery is still a very important part of treating breast cancer patients. And don't forget the mammography screening, which influence the prognosis. Pathology, as you said, is a central discipline in all these things because we assist both the surgeon and the oncologist, and their decision is based on the pathology workup of the tissue. We are obliged to take care of the tissue on the best possible way, and it is sometimes a challenge for the pathology lab. Thereafter, we need to involve new modalities of diagnostics in our labs, which, for example, immunohistochemistry and new generation sequencing, genetic analysis, and so on. And the tissue needs to be sufficient and in good state for all these analyses, which is a difficult task. Thereafter, we need also not only to give the prognostic markers and the diagnosis, but also predict the therapy response. And when resistance to therapy appears, then we need also to re-evaluate the tumor with similar tests. So pathology is a very busy discipline in connection to breast cancer cases.
Yeah, thank you. We could see that today. And perhaps a few words on the Congress itself. It's first time a joint venture by the International Academy of Pathology and the European Society. So World Congress and European Congress together. What's your impression about that?
I think that it is a very important event. We have yearly congresses of European Society of Pathology, and the input from the International Academy of Pathology is now obviously very important. We are just at the beginning of the Congress, but I can predict that it will be a great success.
And prediction is your
it's part of the pathology.
Yeah. Thank you very much.
Thank you.